I'm Mabel Jung. Thanks for watching. I'm here now with Gary Ahlquist of Booz and Company. And I wanted to talk with you today, Gary, about some of the forces that have really changed or have encouraged change in the healthcare space. Will continue to do that in the coming years. What are some of the forces that you've seen as driving change in healthcare?
Well, the forces start, of course, with population base. Our demographics, as we know, baby boomers aging, 4.5 million of us every year entering into the Medicare rolls. That is going to continue for the next 20 years. That will drive demand continuously for that period. We have a system itself which is based on fee-for-service as one of the core aspects of our delivery system, which rewards activity. In fact, all the CEOs in our panel this morning talked about how we need to change that system. We have issues, of course, with uninsured and underinsured that may or may not go away depending on what happens with the legislation. And finally, of course, we have the cost issue that has plagued us, continues to. As the panel discussed, we're at 18% of GDP, could well be a quarter of our economy in 10 years. And when you add all those pressures up, it basically tells the leaders in the industry even incremental change won't be enough. We need to do some transformative kinds of actions here.
So do you think that states independently will cry uncle and try to come up with their own legislation and go it alone by establishing exchanges and other more efficient means of healthcare delivery?
I think we can probably look at some predictors of what states will do. One is their general political leaning. So for example, with respect to exchanges, many of the more conservative states have basically thumbed their nose at it to this point and said, we're going to wait and see. The more progressive states, California, Massachusetts, have of course embraced it and are pursuing or have already put in exchanges. And so that's one, and I think we'll see that the states will follow that suit. Underpinning that is frankly the economic condition of the states. As we know, Medicaid itself is underwater in just about every state, and the economies of most states, particularly the northern states, is not robust. And so we're seeing lots of concern about, do we even reduce our funding of Medicaid? So you have this conundrum of, we may want to pass some legislation to mandate participation in Medicaid if you're uninsured, yet we can't afford it. Again, coming back to the same notion of we've got to change the model so that we can provide this care at much more affordable prices than we're able to do today.
What are some encouraging signs? I mean, I think we have pretty much outlined some of the negative aspects of what is happening today, but are you encouraged by anything out there going on
Always
now?
hopeful. I believe for the first time in my 30 years in this industry, we see a different attitude between the provider leaders and the payer leaders. It even came up today, Lloyd Dean, the CEO of Dignity Health, made a point to say, the future, I asked him the question, will health plans be around in 10 years? And he said, the future, yes, they will be different, but what will be different about them is that we and they need to collaborate much more closely than we ever had in the past. Today what we do is we sit down and negotiate and arm wrestle over rates. In the future we're going to need to collaborate and figure out new business models to serve the uninsured or at lower cost than we are able to do today. So that is a very encouraging sign. Attitudes are different. Below that, of course, that has spawned a plethora of experimentation, collaboration, lots of, whether it's accountable care organizations or other collaborations, we're seeing a lot of activity between payers and providers. Some will work, some will not, but what's happening in particular, they're getting to know each other. They're in a different world from negotiating rates to solving a common problem with the same incentives as opposed to disincentives which have caused them to have this love-hate relationship over the years. So I find that quite hopeful.
Very good. All right, Gary
Okay,
Ahlquist,
good.
thank you so much.
Appreciate it.